Ontario's healthcare sector was hammered during this pandemic. Those who kept it functioning were labelled heroes. Now, as the politicians hit the hustings and the system continues to grapple with COVID-19, let's find out how well the party's healthcare promises match the needs going forward. And with us for that, we welcome, in Davenport, Florida, near Orlando, registered nurse Catherine Hoy, who was president of the Ontario Nurses Association. In Thunder Bay, Ontario, Dr. Rose Zacharias, emergency medicine physician who practices at the Waypoint Centre for Mental Health in Penetanguishene and who started her term as president of the Ontario Medical Association just today. And in the west end of Ontario's capital city, Dr. Anna Banerjee, infectious disease specialist and associate professor of pediatrics at the U of T's Temerty Faculty of Medicine and the Dalla Lana School of Public Health, and Dr. Danielle Martin, family physician and chair of the Department of Family and Community Medicine at U of T. And it's great to have you four on our program tonight. Dr. Zacharias, congratulations, maybe, on your assuming your new responsibilities as head of the OMA. That is a job that tends to churn up its presidents, but good luck with that. Let me just, because you all have a different lens upon which you see the healthcare system, get you from your vantage point to tell us off the top here what you think the biggest problem the pandemic has caused in our healthcare system from your vantage point. Dr. Zacharias, why don't you go first?
Absolutely. And thank you for the congratulations, Steve. It's an honor, actually, to represent Ontario's 43,000 physicians. And indeed, I start my term today. But the backlog really, the pandemic has exposed 21 million patient care procedures that have been waylaid during the crisis of COVID. And we recently had an opportunity to poll all of Ontarians, and they said this is the number one priority. It's exposed that we're behind and also that we're exhausted. Teams of healthcare providers are indeed exhausted. It's been stressful, the pandemic, and that's really where we're at.
Dr. Danielle Martin, we had you on this program not too long ago talking about that very thing, but given a new opportunity to speak about this, what would you say is the biggest problem right now today?
My biggest concern right now, Steve, is the number of people who've become disconnected or loosely connected to their family doctor or primary care team. Because we can't get people back in for the canceled procedures or the ultrasound or back up to date on their screening or back on track with their diabetes care or any of the things that have been pushed off and fallen through the cracks in the pandemic if people aren't closely connected to primary care. So I think that is the most important task ahead of us.
All right, Dr. Banerjee, what say you?
I'd say it's a lack of trust between physicians, nurses, and other front care providers, health care providers with the government. And the government has really basically ignored the advice of physicians, infectious disease specialists, public health specialists. And for example, throughout the pandemic, they refused to have sick days for people that were sick and people we knew had COVID, and they had to go back to work because they had no choice. And recently, for example, despite a lot of us saying that it's not safe, they removed the mask mandate for children, young children in schools where most of them are unvaccinated. So that's part of it. I think there's a huge mental health crisis right now, and there's not a lot of resources and lot of wait times. The other thing is that the Ontario government has ignored First Nations, and they've been left to fight COVID basically on their own. You know, when Ford said, you know, we need masks in every school, get HEPA filters, not one First Nation school got HEPA filters and the masks. And so recently when First Nations communities in the north were on fire, and that's not too long ago, it's just in the past month, we've been coming down from COVID, they cut the funding to the nomadic health units through Orange, where, you know, these units were supposed to go in and give support to the communities. So I think there's been, all of this points to the lack of trust.
All right, lots to follow up there, which we shall do over the course of our discussion. Catherine Hoy, how about from your vantage point?
I'd first like to thank you very much for the invite. It's such an honor. But listening to the other three speakers, it all comes down to, though, we cannot provide service because of the staffing crisis. The pandemic has led to a staffing crisis that we have never seen before. And the Ontario Nurses Association has been telling the government this for years. I would estimate we're at 30,000 nurses short plus healthcare professionals. And I would have thought that the government would have listened to the SARS report where it said your most important resources are your staffing. And they did not listen to that. Instead, staffing is the largest line item on a budget. So that is where they wanted to save the dollars. So we cannot provide the surgeries. We cannot help the family physicians. We cannot help schools. Everywhere that healthcare touches, because we do not have the staff. And the people of Ontario, they really need to listen. They really need to look at the platforms this election, because healthcare is number one. And your paycheck should never dictate what type of healthcare that you're going to receive. So for us, it comes down to staffing is the major problem of the pandemic.
Can I do a quick follow-up with you on that, Catherine Hoy, in as much as, thankfully, most of the 15 million people who live in the province of Ontario have not been and will not, during the course of this year, be in a hospital. There have been lots of people in hospital, but not 15 million. So we really need you to give us a better sense about when you say there's a staffing shortage, what that really looks like on the ground. What does it mean inside a hospital, at a school, etc.?
I think it's really important to remember that because 15 million have not been in a hospital, at some point in your life, you will be in a hospital. You will. So because it doesn't affect you right now, you need to think about your future. And that's what a government is all about. We have emergency rooms that are running at 50% capacity. That means if there should be 30 RNs in there, there's 15. We have nurses that have 30 patients in medicine units. We have emerge rooms that are having to close on weekends. We have labor and delivery units are having to close. You go into labor and you have to drive another hour and a half so that you can deliver a baby. And what could happen in that hour and a half to make sure that everyone is safe? There are no beds. People are in emerge units, laying in beds for 4 or 5 days. I actually have my best friend's father just passed away last night, and he had to lay in an emerge bed dying for, I think it was 4 days before he got a room. And the family chose to bring him home to care for him because they felt that the staff were so overburdened. Excellent, excellent care. That isn't it. It's the staff. There is not enough staff, and the government cannot keep turning a blind eye to this. Your most important resource is your staff in healthcare. I mean, buildings are brick and mortar and empty beds at the end of the day, but if you don't have someone there at the bedside to care for someone, what is the point? What is the point in investing all this money? If you're going to invest money, as they're saying in a platform, you have to have a solid plan around that. They don't have a plan, nor have they looked at retention of what they're going to do to keep the existing staff there.
Well, let's look into all of this right now, because the reason we wanted you four on the program was to really put through the meat grinder the 4 platforms that the 4 major parties in the province who are running for election right now, what they have to say about healthcare, and then we're going to get your critical analysis of them. Let's start with the Progressive Conservative plan. It is centered on building infrastructure and addressing staffing shortages. And here's what they have on offer. Investing $40 billion in health and hospital infrastructure over 10 years, immediately spending $3.3 billion on hospitals, which includes $1.5 billion to support acute and critical care beds, and $300 million to address the surgical and diagnostic backlog, which we've had referenced here tonight. Investing $764 million over 2 years to retain nurses with incentives such as $5,000 per worker. We'll find out if that's doing the trick. Immediately invest $230 million to staff hospitals and the healthcare system, and invest $1 billion more in home care over the next 3 years, including a so-called Ontario Seniors Care at Home tax credit, which was just introduced in the last budget, which, as we all know, has not actually passed, but was introduced. All right, let's get some critical analysis of this. Dr. Zacharias, what do you like? What are you concerned about?
Well, indeed, I am heartened by the investment in staff and in system capacity. But I'm going to come alongside my colleague, Catherine, and speak to the healthcare providers that are burnt out and are running on near empty, because that's where we need an investment in the human health resources. And I know what it's like to work in that emergency department. I've had 20 years of my medical career working hundreds of emergency department shifts and being called to the hallway where the paramedics have brought in someone with chest pain. And we need to determine right now how quickly we can get an ECG to determine if this patient is having a heart attack, and then probably ship them out to get the care they need at a catheterization lab and deal with these urgent crisis issues when we have a shortage of nurses and even physicians that are not able to show up for their shifts all the time because they're double booked and they are exhausted. We indeed did have some emergency department closures just recently in Ontario. And so we know burnout is at an all-time high. A recent Canadian poll showed 53% of physicians operating at high levels of burnout, and 46% of Canadian doctors are saying they intend to cut back clinically in the next 2 years. And so it's all well and good to say we're going to pour money into buildings and capital infrastructure if this is increasing capacity, because yes, we cannot do this type of medicine in the hallway, but we cannot forget the people. And that's a little bit more complex, a little bit more ambiguous, but this is where the strategy needs to go. How do we retain and how do we recruit? I come to you today from Thunder Bay. Northern Ontario is short over 350 doctors right now to do the care that we need to do right now. And yet the pandemic has backlogged us. And so we need to catch up. There's just an enormous amount of work and we need healthy people to provide the care. So this is what I'm looking to when the parties release their platforms. How are they going to address this?
Okay, Dr. Martin, you hear what the PC party has on offer. Do you think it will go some way towards dealing with the issues the healthcare system is facing today?
Of course, much of this, Steve, is necessary, but it's not going to be sufficient. And, you know, all of the platforms actually read like a classic Canadian approach to healthcare, which is, you know, we want to invest in healthcare quick. Let's look at hospitals. Let's look at doctors and nurses. But in fact, as you said earlier, most Ontarians this year will not visit a hospital. What most people need is access to primary care in their local communities. And so as we think about the build back out of this crisis, you know, a lot of the people who we end up seeing in the hospital or in the emergency department could have been better managed and supported closer to home if they have easy access to high quality primary care services. And that, I think, is where we really, it's never as sexy and it's never as easy to explain as, you know, investing in hospital beds, but actually it is the most critical foundational element of a healthcare system. And we can stop people from landing in the emergency department with heart attacks if we can control their blood pressure, their cholesterol, you know, their stress level, and support them in quitting smoking. All of that happens closer to home in primary care, and that's where the investments are needed. And unfortunately, I'm not seeing a lot of conversation about that yet.
You're not seeing that in the PC platform so far? No.
That's right. I'm not seeing it. It's not. I don't see it as a platform priority in any of the platforms.
Okay, let's go on to Dr. Banerjee. You talked earlier in the first answer you gave about a lack of trust in the system. These items that I've just outlaid, do you think they will help to repair the lack of trust that you see in the system?
The money is important, but $40 billion, like, where's that going to come from? We recently had checks back for our driver's license, but what are they going to cut? You know, are they going to cut primary care? Are they going to cut nursing care? You know, so I think that money in some infrastructure is good, but it's not sufficient. We need to support nurses, especially, because I think that there really is a lack of trust. Like, why would we trust this government if they have, like, all of a sudden $40 billion to invest in infrastructure? Why didn't they pay the nurses more? Why do they have Bill 124 to limit the wages? And so I think that there's a lot of work to do.
All right, Catherine Hoy, the budget, as I say, that did not pass but was introduced, allocated $70 billion for this fiscal year for healthcare alone. That's record spending. You now see what else the PC party has on offer. How far do you think that'll go to address the issues you've raised earlier?
Well, we've already heard that, well, the budget hasn't passed, and he may not see through the budget. So trust is a big issue. I mean, we heard from the auditor that billions of dollars that were earmarked for COVID were not spent. So there is a trust issue. I said before, it's bricks and mortars and beds if you don't have staff. And this government has had 4 years to fix healthcare, but all they've done is made it worse. And so what are they going to do?
Can I jump in there for a second?
Sure can.
They have made it worse? They really have made it worse?
Absolutely. They have made it worse. Look at the staffing crisis that we have now. Bill 124, that is a targeted bill to a female-dominated profession. I mean, for all the women here, all the people that have daughters and granddaughters, do you want them treated like that when we have a government that targeted a female-dominated profession? You know, try and explain that when the male-dominated professions, and don't get me wrong, police are part of our team. We are all first front line, and we serve our communities. But when the police have escalated, I think it's around 14% over a female-dominated profession, how is that fair? That is not fair. And also when the government put into play Bill 195 that suspended our basic workplace rights, like nurses can't get vacation. They're burnt out, PTSD. And he's also looking at more privatization. And what does that do? So our tax dollars will go to new private facilities to provide care, which really means that care will go down, because when it's for profit, someone needs to make a profit.
Well,
so
let me
those
just,
dollars,
okay. I'm worried about letting the clock get away from me here, because we still got 3 more platforms to get through. But the only reason I pushed back a little bit, maybe Dr. Martin, you can respond to this. Did this government make healthcare worse, or did COVID-19 make healthcare worse in this province?
I mean, of course, it's got to be a little bit of column A and a little bit of column B, Steve. And there's no government of any political stripe across this country that should stand up and wave the flag saying that they handled this pandemic perfectly. And that's also true in Ontario. That for sure, it's been an incredibly hard time, and that it's a global health crisis that has put every health system in the world, run by every kind of government, under tremendous stress and pressure. Did this government make mistakes? Yes, it did. And some of those mistakes were really important and cost lives and cost and increased pressure where it wasn't necessarily where it didn't need to be increased. And so, I would like to see any premier across this country or any territorial leader stand up and say they think they did a perfect job of it. I don't think anybody can. I think the question is, we're here now. What's the build back going to look like? And are we prepared to learn from those mistakes? Are we prepared to say, okay, well, what did we learn in this pandemic? We learned virtual care can be used in ways that are actually effective and helpful. We learned that some communities are not at the same risk of getting sick as other communities. We learned that if you work an essential job on contract and you don't have benefits and you lose that job, you lose your drug coverage. We learned that mental health is actually part of the healthcare system and needs to be addressed. Like, those are actual, real lessons that came out of the things that were done right and the things that were done wrong by this government and others in the pandemic. So how are we going to take those lessons and actually use them to make a better healthcare system coming out of it? That's the conversation that we should be having.
Well, let's continue it here. Here's what the NDP has on offer for this 43rd general election campaign. Making mental health universal by expanding access and bringing therapy under Ontario's health insurance plan coverage, OHIP. Investing $130 million over 3 years to bolster children's mental health services and reduce wait lists to 30 days. Improve mental health crisis response through increased mobile crisis services and safe bed programs. Immediately hire 10,000 PSWs, 30,000 nurses, expedite recognition of 15,000 internationally trained nurses and also hire 300 doctors in Northern Ontario. We've heard reference to the need for that. And eliminate Bill 124, which has also been referenced here. That would cap wage settlements at 1%. I'd like to know, who do we go to first here? Dr. Banerjee, start us off here. That's the NDP's Build Back Better. How does it sound to you?
I think that the focus is on mental health, which is really important after this crisis. And so I think they have a fairly good program. They're the only party that addresses the issues in Northern Ontario by increasing the number of physicians. And they say as well that they want to support Indigenous-led healthcare. And to me, when you have such differential access to treatment and treatment services, screening, et cetera, and funding, really, it's very unfair. And a lot of people would call that an apartheid system. And they're the only government so far that I can see where trying to address some of the issues in the North is part of their policy. I'm not surprised the PC doesn't have anything there, but I couldn't see anything Liberal, but I do see that for the NDP party.
All right, Dr. Zacharias, I presume you're going to like the hiring 300 doctors for Northern Ontario, but you know as well as anybody, you can't just snap your fingers and 300 docs in the North appear. So how realistic is this plan?
So when I look at this plan and when I look at every party's plan, it's not a mystery to me how, and speaking to my esteemed colleague, Dr. Martin's question, what does this look like? What indeed does building a robust healthcare system after the pandemic, what does it look like? And so Ontario's doctors, actually speaking to the relationship of trust, have written a prescription for Ontario. After our most extensive consultation in our 140-year history at the Ontario Medical Association, we are putting forward a prescription that lays it out, achievable, realistic goals. People can read about it at betterhealthcare.ca, but we've designed it around 5 pillars, addressing the mental health tsunami that indeed is coming now after the stress and strain of COVID, but also that investment in community and home care, as we were just talking about, catching up on the backlog, also developing a public health strategy so that when the next crisis comes our way. I mean, Ontarians, they paid such a price in restrictions and lockdowns while we worked to save the healthcare system. And we need to have a better plan. We are at a different place now. March 2020, with no vaccines and no particular plan how to address a pandemic, we have learned so much more. So we need to invest in the public health knowledge and infrastructure to be prepared for the next time so it doesn't cost us so much. And lastly, we've spoken to this, but 1 million people in Ontario still don't have a family doctor. And so our 5th pillar in our prescription for Ontario is providing every Ontarian with a family doctor and a healthcare team that's wrapped around them and is digitally connected so that we take advantage of the virtual advancements we've made as we were forced to in COVID and use that to the advantage of providing better care for people. That's what I would say.
All right, Catherine Hoy, I see in here 30,000 nurses, 15,000 internationally trained nurses having their credentials recognized. You talked about the need for 30,000 nurses, but again, you can't snap your fingers and have them show up tomorrow. How realistic is this plan?
The plan could be realistic if they would work with ONA, to be brutally honest. I have spoken with the Premier in the last several months about developing a program for the RPNs, a fast-track program.
Registered practical nurses.
Registered practical nurses so they can become registered nurses. They've increased the seating in the RN program, but we're not going to see those results for 4 to 5 years, and we cannot wait 4 to 5 years for those nurses. So we need a fast-track program, and that's where money should be spent. Money should be spent on retaining and growing more registered nurses to put into the system. And we need to work together. We need to work together, and the NDP government has committed that they would do that.
Well, they're not the government yet. They're trying to become the government.
They're not the government yet, but we're just talking about their platform.
Right. All right. Let me get Danielle Martin for a word on the NDP platform and what you think about that.
I agree with you, Steve, that it's wonderful and important to talk about hiring more nurses and bringing doctors to where they're needed, but those are things that are much more easily said than done. And so I think, the important thing in this platform to remember is that probably if we actually want to achieve goals like this, we're going to have to grow the team. Right. And that means, look, I train family doctors for a living. I would love to just train more family doctors. But actually, the way you get more primary care to people is by growing the interprofessional team, by making sure the pharmacist is doing the parts that the pharmacist can do, the social worker is doing the parts that the social worker can do, the nurse is doing the parts that the nurse can do. And then you actually don't need as many family doctors. And some of those family doctors can be at a distance, et cetera. And so a lot of this stuff is actually going to be about the impact may be the same down the road, but it's never really about hiring doctors and nurses. If you really want to have an impact on access to care, you have to grow the team. And admittedly, those are not easy things to fit into the bullet points of a political platform. And so, I get that. But I do think actually the real solutions on the ground are going to have to be a little bit more creative than just doctors and nurses. Much as I love doctors and nurses.
Yes, you do. Okay, let's do the Liberal plan now. Sheldon, if you would, the next graphic, creating a new ministry focused on seniors, which would oversee long-term care and home care, increasing the annual budget for home care by more than $2 billion annually, creating 15,000 new assisted living homes consisting of smaller residences, creating a dementia care network, and again, there's that Get Rid of Bill 124, the bill that would limit salary increases for people in the healthcare system to just 1%. Sheldon, that's what I want, a four-shot there. Any takers for this plan here? Who likes what they hear?
I'm happy to step in.
Sure.
Indeed, there is an emphasis here on long-term care. Our seniors paid too high a price in COVID. And we know, as per the prescription for Ontario and the consultation, that this is indeed a priority. Traditionally we think about people get sick, they come to the emergency department, they stay in the hospital. When we talk about how much it's going to cost to rearrange things, we need to know that it actually costs about $500 a day to care for someone in the hospital. It costs about $150 a day to provide that same care, but in a long-term care facility, and even less money spent to provide that same level of care in someone's home.
So the economics are obvious.
Absolutely. And so there is savings to be found. And then the emphasis on providing care for people where they are when they need it needs to be looked at very seriously. So if indeed this platform is addressing that, then fantastic. We're about to come out with our report card next week, and we're happy to share it with Ontarians, sizing up each political platforms and how it aligns with the prescription for Ontario. And we'll be happy to share that information.
Dr. Zacharias, why don't you just scoop yourself tonight here on TVO, because we've given you the platforms. Just give the letter grades out right now. Come on, go for it.
So if platforms indeed line with the prescription, if they are having a serious intention of catching up on the backlog, if they are investing in home and community care, if they are dealing with the mental health infrastructure and investing in it there, as well as that public health strategy, and as well as Dr. Danielle Martin has very aptly put it, providing healthcare teams, providing all of the players digitally connected and working together to provide the care. We talk about mental health, and that is actually a very specific example where you need a team. We need community-based, publicly funded psychotherapists, actually, to meet the needs of our kids who have struggled with their mental health in COVID. The school closures, the uncertainties of income loss in families, those are real and present stressors in kids' lives. And so it's a little complicated when you say, we'll build a bigger hospital and care for people. That's a need that wouldn't be met with a bigger hospital. That will be met with healthcare teams, community care investments. And so that's what I'll be looking for. That's what the OMA is looking for.
Well, since you brought up mental health, and since the clock is ticking faster than I want it to be, let's pick up with the Green Party plan here, because it very much focuses on mental health. For example, expanding access to mental health and addiction care under OHIP. Have the health insurance plan pay for it. Increase mental health spending from 7% to 10% of the healthcare budget, and invest in youth mental health care. Have a mental health wait time reduction strategy, and supporting Indigenous-led mental health care clinics. Dr. Banerjee, what do you like or not like about any of that?
I like all of that, especially the Indigenous-led mental health care system. I think if we can get more access to not just physicians, psychiatrists that deal with certain kinds of mental health issues, but if we can get funding for people that can't afford seeing a psychologist, I think that's very important, because I think that there is, as people said, there's going to be a tsunami of people with, where they need mental health support moving forward.
Catherine Hoy, what do you like or not like about the Green Platform?
Well, we'll always support more care for mental health, but to be honest, they have not released enough information for us yet to really have an opinion on the platform.
I've heard that criticism from others. It's interesting. Dr. Zacharias, well, no, let me hold off on that. Let me just go to this, because we're going to run out of time, and the folks in the next segment are going to get mad at me because I took time away from them. Dr. Martin, sum it all up for me here, in as much as people are looking for whatever good may have come out of this pandemic. I don't know, what we might have learned new that we didn't know before. Resiliency of the healthcare, I don't know. You tell me, what good came out of the last 2 years?
To me, the most important thing about this pandemic is that it has changed the way that we all talk about health, to acknowledge that your chances of getting sick and dying over the last 2 years depended on where you live, on what your income was, on what your job was, on what your housing situation was. All of this talk about the so-called social determinants of health, that the social factors that contribute to whether we get sick or stay healthy, suddenly are being acknowledged and talked about. Suddenly we're talking about sick days for working people. Suddenly we're talking about unsafe work environments. And so, the notion, and to be honest with you, Steve, although I'm very happy to talk about analysis of healthcare platforms, truly, if we want to know how these parties are committed or not committed to health, we should be looking at their economic platforms. We should be looking at their social services platforms. We should be looking at the way in which they're approaching education. We all saw in this pandemic that those are the things that determined who got sick and who died. And so that, to me, is the biggest opportunity, is for us to talk about health beyond just healthcare. And I really hope that we don't forget that lesson as we look forward to what the future should look like. It cannot be all a conversation about hospital beds. It's got to be a conversation about the root causes of health and illness.
Dr. Martin, that is excellent advice, and I can assure you we will be taking it here at TVO over the next month as we put all of the platforms on all of the things that you just mentioned into the meat grinder, so to speak. Dr. Rose Zacharias from the Ontario Medical Association, Dr. Danielle Martin at the U of T, Dr. Anna Banerjee at the U of T, Catherine Hoy, Ontario Nurses Association. Thank you all for joining us on TVO tonight.
Thanks, Steve.
Thank you, Steve.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.